Greetings everyone, I am Bachkangi, a consultant gynecologist, and today we will discuss the efficacy of Bulkamid in the management of stress incontinence. First of all, I would like to express my gratitude to Dr. Ibrahim and Ms. Salman who helped me with the abstract, and also to Prof. Tan and Dr. Quinn who helped me with the statistical analysis. Stress incontinence is a common condition affecting 1/3 of the female population, and there are different approaches in managing it. However, recently there has been an erosion of patient confidence due to the publicity around the mesh-related issues. In the recent years, there have been different surgical methods introduced aiming to manage the incontinence with less surgical complications. Now, Bulkamid urethral injections is one of these novel techniques, and it has proven to be a safe method, but with limited research studies examining its efficacy. So the aim was to examine how effective and safe the Bulkamid injections are, and for that we conducted a retrospective study in a busy trust, the United Lincolnshire hospitals where I used to work, and we included all the patients who had Bulkamid since its introduction in 2016 and for the following 3 years. Our results showed that 108 patients had the procedure in total, half of them performed by gynecologists and half by urologists, while 90 patients had it for the first time and 18 had it a repeat, and most procedures were performed by consultants. Most importantly was that 65% of our patients were fully satisfied with successful results and with no intraoperative complications and just 5 post-operative complications. Another very interesting finding was that younger age was in favor of the success of the procedure. As you can see in the figure here, there is clearly statistically significant difference between the age groups and the success of the procedure. One more interesting result was that the gynecologist had better success rates than the urologist, as you can see in the figures and with statistics. Having analyzed other contributing factors like BMI, surgical time, hospital, the type of anesthesia, previous surgeries or physiotherapy beforehand, all these factors do not seem to affect the success of Bulkamid. Of course, we need to take into consideration that the data were collected during the learning phase of the procedure by the surgeons, and these surgeries were performed by consultants and trainees from different specialties and different surgical exposures. So with regards to the other conventional surgical methods, which started re-emerging, especially after the mesh pose, we need to consider that due to the complexity, invasiveness, and the potential complications, the market is still searching for alternative and safer methods for surgery, and Bulkamid could be one of them. Having said that, the recent NICE guidelines suggest that bulking agents should be offered only if alternative surgical procedures are not suitable or acceptable, in fear that there is limited evidence about bulking agents and there is a need of repeat injections. Here we need to specify that urethral bulking agents is a very broad term, as previous long-term studies focused on collagen as a bulking agent, and as you can see in the slide, there is another bunch of bulking agents in the market. Now, most of these issues are not applicable on polyacrylamide hydrogel, where the available studies so far showed that it is a relatively safe and successful procedure. So to conclude this presentation, Bulkamid is a successful method to manage urinary stress incontinence in women. Our success rates were similar to the ones mentioned in the literature, regardless of the experience or exposure of the surgeons. Our complication rates were notably lower, and hopefully in the long run, the follow-up studies will answer the long-term efficacy of this method. Thank you very much for your concentration, and I hope you enjoy the conference.